Hi, my name is Kelsey and I'm a Temple medical student. Today on Health ABCs, we'll be talking about hyperthyroidism and hypothyroidism. In this talk, we'll be answering what is hyperthyroidism and what are the causes, what is hypothyroidism and what are the causes, what are the common symptoms for both, how are they diagnosed, what are the treatments, and where can I find more information. First, this talk was solely created by medical students for the purpose of patient education. It is not to be used as medical advice and does not replace seeing your doctor. To begin, what is hyperthyroidism? Hyperthyroid is simply too much thyroid hormone. I want to start by talking about the thyroid gland, which is a butterfly-shaped gland in the middle of your neck. This gland produces thyroid hormone. This starts with two areas in the brain called the hypothalamus and the pituitary gland, which are shown in the circle on the picture. The hypothalamus produces thyroid-releasing hormone, TRH, which turns on the pituitary gland to make thyroid-stimulating hormone, TSH, which lastly turns on the thyroid gland to make thyroid hormone. This is a delicate closed loop, meaning the thyroid hormone will then turn off the hypothalamus and pituitary gland once there is enough thyroid hormone made. The most common cause of hyperthyroidism in the US is called Graves' disease. Now, this happens because the body produces antibodies that turns the thyroid gland on to produce more thyroid hormone. Another common cause of thyroid are thyroid nodules, which is an area of growth in the thyroid gland that can produce thyroid hormone. One last common cause of hyperthyroidism is a short-term period before hypothyroidism. This can be a little confusing, but often in hypothyroidism, the thyroid gland is destroyed and releases that stored thyroid hormone. In doing so, it manifests as hyperthyroidism for a short period of time. There are several other much less common causes of hyperthyroidism, and more information is shared at the end of the presentation. Now, what is hypothyroidism? Hypothyroidism is the opposite. It is a lack of thyroid hormone. The most common cause in the US is called Hashimoto's disease or Hashimoto's thyroiditis. It is an autoimmune disease, meaning the body sees the thyroid gland as foreign and creates an immune response. Antibodies are produced against the thyroid gland, which will lead to the destruction of the gland. Other causes are radiation, which will also lead to the destruction of the gland, surgery to remove the thyroid gland, certain medications that can be discussed with your doctors, or a lack of iodine, which very rarely will occur in the US. Another rare cause of hypothyroidism is having fibrous tissue replace the normal cells of the thyroid gland. There are also other causes that can lead to short-term hypothyroidism, such as infections or after pregnancy. These may require short-term treatment, but usually resolve on their own. Now, what are the common symptoms? So thyroid hormone is responsible for maintaining regular metabolism and growth. I think a good way to think about the symptoms of hypothyroidism versus hyperthyroidism is that hypothyroidism slows everything down, whereas hyperthyroidism ramps everything up. The symptoms of hypothyroidism are listed on the dark blue side of the picture. Hypothyroidism commonly leads to dry skin, coarse hair, brittle nails, weight gain, constipation, fatigue, and an inability to be in the cold. Other symptoms can be depression or forgetfulness, muscle aches, changes in your menstrual periods, or arthritis. The symptoms of hyperthyroidism are shown on the light blue side of the picture. Hyperthyroidism commonly leads to the opposite of hypothyroidism, such as warm and moist skin, excessive sweating, soft nails, weight loss, increase in bowel movements or diarrhea, inability to be in the heat, or increase in heart rate. Other symptoms are tremors, nervousness, irritability, weakness in the muscles, decrease in menstrual periods, and another very specific sign for Graves' disease would be bulging of the eyes. So how are they diagnosed? Diagnosis will begin with a history and physical exam with your doctor. The constellation of symptoms can very quickly lead your doctor to the diagnosis. Laboratory tests for hormone levels is the next step to confirm the diagnosis. If you look at the picture on the right, it explains laboratory findings in both hypothyroidism, where T4 and T3, which represent thyroid hormone, are low, and TSH is high because it is trying to turn on the thyroid gland to make more hormone. And in hyperthyroidism, where it is the exact opposite, low TSH levels because you are making too much hormone, and high T4, T3 levels. Another blood test is to look for the specific antibodies produced in Graves' disease and Hashimoto's disease. Doctors can also use a test called radioactive iodine uptake. This is performed by injecting radioactive iodine that the thyroid gland will take up and then subsequently scanned. The amount that is taken up can help diagnose and characterize thyroid disease. This test is not always indicated in diagnosis. Discussion with your doctor is warranted to individualize which tests or imaging are necessary in each person's case. What are the treatments? Treatment of hypothyroidism is simple. Replace thyroid hormone. Synthyroid is most oftenly used. Treatment of hyperthyroidism has more options. It starts with medical therapy. These medications prevent the thyroid gland in producing thyroid hormone. Other medical therapies are used for symptom relief. For example, beta blockers will decrease the heart rate. Further treatments are more definitive therapies and are used after medical therapy has been tried. One is radioactive iodine. That is different from what they use for diagnosis purposes, and this will destroy some of the thyroid gland cells. Another is thyroidectomy, which is removal of some or all of the thyroid gland. And lastly, this is where more information can be found. The top two are general information about thyroid disease and thyroid glands. The next one is general information on hyperthyroidism, and the last link is information about hypothyroidism. Thank you.